Better sleep, sharper focus, a healthier life? It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
All right, everybody, welcome to our podcast. I am so excited to introduce Lisa Cramer from Mind Body Neuro, Colorado. She's also in different states as well, so you could be seeing her elsewhere. But Lisa, why don't you go ahead and introduce yourself?
Sure. Thanks for having me. My name is Lisa Cramer, as she said, and I'm a licensed professional counselor in Colorado and a licensed clinical professional counselor in Illinois. That's the same thing. But I'm a neurofeedback specialist, and we have a clinic right outside Denver, in Lakewood, and then in Illinois outside Chicago in Lombard. So yeah, really excited to be here.
And you know what's so fun? So we got connected because, as a lot of you know, I've been on whatever journey I can be on with my children. I use them as proof of concept that stuff that we do works, because I find the layers to the onion to keep on peeling in terms of their health. And we got introduced to neurofeedback, and lo and behold, Lisa's actually right across the parking lot of my dental office. And neither of us knew we existed. And now I'm just really excited we get to share patients. And I think there's so many implications between what we do and with neurofeedback and the offerings that you guys have. So I think one of the biggest things that I struggled with when I was first learning about this was, what exactly is neurofeedback, and how would you describe what it does, what it helps, who it helps? That's a big question.
Yeah. So the usual comment is, I've never heard of that, right? So neurofeedback as a whole is a modality that helps train brainwaves to reduce symptoms. And that's a really general comment, general description, but we do that because it can help so many different things depending on the brain. We don't need a diagnosis or a certain medication or something like that to have it work for someone. It's really based in each person's individual EEG, which is your brain rhythms. Like an electroencephalogram is your brain, where EKG is your heart rhythm. So we measure that. We take a really non-invasive, very safe assessment and take a look. And that's our starting point for everybody.
Yeah. And so when we first started our journey with you guys, I just thought it was so interesting, because as somebody who likes science and data, for you guys to be able to take the data you had, of which you got quite a bit, even though I have a very wiggly 6-year-old at the time, you were able to get quite a bit of data and really, without me telling you a single symptom, point and say, this could be causing this type of behavior. This could be causing this type of feeling. So do you want to talk a little bit more about kind of like what you guys can draw from the EEG?
Sure. So the EEG, like I said, is a measurement. It's just a recording. You get this silly little cap put on your head, and there's holes in the cap that we put electroconductive gel in. And then the cap is wired to an amplifier that makes your teeny tiny brain waves big, just like a guitar amp makes the sound big, so that the software can actually record, So, and what are we doing there? We're recording eyes open, just sitting as still as possible. Not always easy for little peanuts, or sitting eyes closed, which can even be harder for little peanuts, but also
even for adults. Like my brain is going 100 miles a minute. And kind of before we spoke on the call, I'd love to hear about all the implications you see for children and adults. So when you measure that, you get the amplitudes, and you're able to take your brain map.
Yeah, so we get a lot of data. We get the squiggly lines that you see sometimes going across the screen, and they are showing us the speed of what's going on where in your brain. It's showing us the amplitude, which is power. So certain waves might be really, really strong with giant oscillations, and some might be too small with little tiny low voltage, we call that. So we're looking for those two things. We're looking at where are they showing up. We're looking at networks and communication between areas of the brain. Are they talking too much, like talking over each other, or are they, have their backs to each other and they're not talking at all? And so those things correlate very often with behavior outcomes, emotional outcomes, learning outcomes. And so often I can look at something and say, do you have trouble waking up in the middle of the night and not being able to go back to sleep? Because there's a specific brain pattern that will show up that's an indicator. I'm not just, voodoo, but so there's a lot we can glean from that information. And we take that and pair it with the specific complaints of what someone's struggling with or the kiddo is struggling with, and then make a plan to go from there.
And then when it comes to some of these symptoms, like what are you guys seeing run the spectrum? And I'm sure it's broad. Like we see the same thing in airway related health. And we do the same thing. We look at somebody's facial structure, we look at their CT, and we can say, I suspect this is the pattern, this is the symptom. Do you struggle with X, Y, and Z? So it's interesting when you have diagnostics to drive kind of like what the symptoms could be. So for you guys, what would you say some of your main symptoms are being reported by patients that are coming in or parents that are concerned about their kids?
Sure. Well, I think the number one by far and away is anxiety. And that goes from 5-year-olds all the way up to 90, right?
Sorry, here, start over for that one. I lost you for a second.
Okay.
So main symptoms.
So main symptoms.
It might be me. It says my internet is unstable. I'm going to give it a second. Okay, that's better.
Okay. Is it better? Okay.
Yeah.
So the main symptoms or complaints that walk in the door is anxiety. I'd say that's the number one thing. And as we know, for the last 5 years or more, that has really climbed and climbed. So from little ones that you wouldn't think have anything to worry about in their life, 6, 7, 8-year-olds that are lying awake at night worrying, or having stomach aches because of it, all the way up to, 40, 50, 60, 70-year-olds. So anxiety is number one, but we see a lot of learning issues. So if kids are delayed or they have processing issues, attention and focus, typical stuff, down to dyslexia, dyscalculia, specific learning trouble. Emotional dysregulation. So that's my favorite, is to help the families that are having kids that are having complete meltdowns and they are disrupting the home. It's destroying their social connectedness with others. It's causing them trouble to learn and stay up with the rest of their peers in school. So that's a big one. And then typical stuff that most people would go to for mental health help: depression, sleep issues, cognitive decline, memory, or brain fog type stuff. And then we also see quite a few for concussion and TBI help. So yeah, kind of a broad thing.
Do you see a lot of your concussion TBI patients having concurrent pain or chronic pain along with some of their symptoms?
Chronic pain is a big one. That is, there's Dirk de Ritter is a really well-known, he's a scientist in the neuro field in Europe and I think New Zealand, but he likens it to almost like, what's it called? Phantom limb. The brain is stuck on a pattern and it's repeating a signal to you, even though what's causing the pain is actually gone. So there's rhythms, and dysrhythmias in the brain that can cause that. Yeah. So those are sometimes things that respond really well. Head pain, that there's no reason for the head pain anymore, but they're still experiencing it.
So you're just getting them off of that track, like kind of breaking the cycle where it's just stuck on that track. That's wild. Exactly. And then you mentioned the last 5 years. I know at one presentation I saw you said that like the patterns that you're seeing post-COVID are just different than anybody's ever seen. And how would you explain that? Do you think it's like the anxiety of the kids from the parents? Do you think it's like kiddos being born? Do you think it's just we're living in this heightened state of protection as adults? What do you think it is?
It's probably some of all of that. And I'm not an MD, but I do think the virus itself, for those who experience having the virus itself, whether they got ill or not, has done some changes in our brain. And so there's something called ischemia, which is reduced blood flow. And when we see that in certain areas in the brain, usually it's on the temples on the side, we can see that in the EEG or indicators that that's going on. Very often, or that would be all over the brain, that would be post-viral COVID, right? But it's also this, our world was turned upside down, and it's really not totally back. Maybe just now I kind of feel like we're kind of in the norm again. So I think it's all of that. It's also social media.
Yeah, of course. I mean, that's a whole nother conversation. Like I just finally read The Anxious Generation, because sometimes for me, ignorance is bliss. Like I can live in a state of, I want to fix everything. I am very open to ideas. And so I finally took the plunge and read it. And I just thought his thought processes were so poignant behind it all, and how social media has changed the way that we process and the way we get response. And for me, even like doom scrolling and the dopamine response, I can only imagine how that impacts children and how that's impacting our current population. Do you see like social media addiction in some of these patterns? Do you see addictive tendencies in some of these patterns?
Oh yeah, because there's withdrawal, right? And there is somewhat of a tolerance building, meaning you need more and more to feel the same. The other piece is when we have teens and 20s, I would say, that are willing to take a break from it and put it down or take it off their phones, man, do they do so well, and they realize it. And that's a powerful thing, because they get it. They're like, oh wow, this is really, really impactful.
They feel a difference. Yeah.
And they're designed to addict them, right? All the algorithms behind that are built so you come back for more. Yeah.
Oh, it's so hard. Well, and I think in terms of treatment options, like there's neurofeedback protocols that you guys have, but you also couple it with talk therapy, correct? In many cases.
We can, yeah. That's probably the ideal. At least at some point. It depends what someone's coming in for. But the whole reason I started in this field was I was doing therapy for 15 plus years. And I had a handful of clients that maybe I was their third or fourth therapist, right? And they're trying their third or fourth medication. And they aren't getting better. And they're frustrated. And I'm frustrated. And I kept thinking there's got to be something more that's keeping them stuck. And then I came across neurofeedback at a trauma certification training, and immediately the science-backed approach and the data-driven path it gives you, I loved. It just fits with me well. But the outcomes when the clients let me practice and just when I was just learning on them were astounding.
Yeah.
So the field, it's not super well known. I think it's growing and growing, but it doesn't pair well with pharmaceuticals, in the sense that we get people off their medications, or we can help pinpoint what meds are actually going to work or not due to what we find on their EEG. So when we look at that, big pharma is not going to fund us.
Totally. And that's it's a hard state that we're in, right? Because the whole state of medicine is prevention doesn't pay. And I think that's what we see a lot in preventative dentistry as well. Even like down to, we won't fix a tooth that's broken because we want it to break further before we make the decision. Then you can just take it out.
Yikes.
And it's a hard world, because a lot of us are looking for preventative matters instead of reactive medications or like the hardcore fixes that we have to go through. So you're able to kind of look at that data and say, this type of medication is likely not going to be as beneficial as this type of treatment.
Well, in a general sense. So there are patterns. So say someone has what we call high beta, which is a faster brain pattern, and it's dominating. And we add a stimulant because they have traditional ADD and they're not able to pay attention. You're adding a stimulant to an already over aroused, hyperexcitable cortex. That is a recipe for disaster. But no one knows that until you get your EEG done.
And would you say, do you think high beta is, this is just a question, I don't know the answer to it, but do you see a lot of high beta in people that aren't sleeping well?
Yeah.
So that's kind of like my shtick is, if we're not breathing well, we don't sleep well. And then we get the same symptomatology as somebody that's diagnosed with ADD, ADHD. And then we put them on a stimulant, which only exacerbates it. But it's so crazy because you're seeing the same thing happen in the brain and you can see it on paper, which is wild. So in terms of like those kids finding you, is it mainly word of mouth? Is it therapist driven? It's likely not pediatrician driven because they probably don't know
there.
Is
they don't. I would say therapists are probably the number one that are bringing them in. There are a handful of neurologists that will say, yeah, this might be good for you. For our clinics, we get, the most referral from providers would be either functional med type folks or even PTs, I think, because they realize if there's emotional or thinking trouble happening, they're not going to show up for their sessions, right? If they're depressed because of a concussion or having a knee replaced or whatever it is, that makes it really hard for them to get themselves to their treatment from physical therapy or occupational therapy or anything they're doing. So they're recognizing if we handle that end, their side will go much more smoothly.
Yeah, and everybody wins because then treatment works because people are there and they're getting the support they need. So you mentioned beta. Can you go through like some of the basics of the brain waves, the brain patterns? Because I think that's something I still don't understand fully, probably never will, but I think it's so fascinating for us to kind of link those things together.
Yeah, so the EEG and why we record that first has kind of a nomenclature to it. So it has, when we look at brain waves, we divide them into speeds and buckets of like ability, what they're doing for you in your brain. So the main ones that we look at they all have Greek names. So delta is the slowest that we look at. And it's about 0.5 to 4 cycles per second, meaning it goes up and down is one cycle. So they might get 1.5 or up to 4 in 1 second. Really slow. That's deep sleep. It's babies that are newborns that sleep all the time because their brain's developing. So they haven't built the speed up yet and the connections to make the speeds faster. So they have a lot of delta. It's also very significantly impaired, developmentally delayed folks have a lot of delta, right? And for whatever reason that happened, it's kind of frozen there, so the development doesn't move forward. But it also can be the end stages of life or tumor or things like that. So in anyone over 4 years old in an awake recording, we don't want to see a predominant delta. It's not very often. The next one's theta, and that is double. So about 4 to 8 hertz, 4 to 7.5 hertz cycles per second. And it is your drowsy, like you're falling asleep or you're just waking. It's imagination. So like a 4-year-old has their imaginary friends. It's a very internally focused brainwave. So meditators and people that are in the flow, if they're creative or athletic and they're trying to get into that flow kind of a state, it's a reverie state almost.
So theta can be a goal for those that are seeking like cognitive awareness, kind of that like deeper state.
It is
imagination and creativity.
It's more of a like what you would think a meditator's trying to obtain.
I see.
That like sense of no thought and stillness. But it also can be, where people laser focus, like
interesting.
So, but it's considered a slow wave. So it is not what we want in a 10-year-old or a 40-year-old in an awake EEG. So it's still considered slow wave. The next one's alpha, and that's a big important one. And it's about 8 to 12, give or take. All these are a little arbitrary, but alpha is really important. It's your neutral when you're awake. it's your ability to shift gears. Gives us an idea of processing speed in the back of the head. And it also helps us kind of know where you are in space. Proprioception kind of an idea.
Mm-hmm.
But also, we want a lot of flexibility in the brain. We want to be able to shift back and forth between theta and alpha and beta, which I'll explain in a second, and really be agile. And your brain's really fast, really, really fast. So those things if you have too much alpha, you can be stuck. Like you don't do well transitioning between times.
Too much, too little could be a
Yeah.
problem.
Right. In any of these, it's kind of like we need the sweet spot instead of too much or too little. So in following alpha is beta. That's our good beta in the sense of it's your thinking waves. It's your attending, it's taking in stimulation, sensory information, and doing the right thing with it, sending it to the right part of your brain and being able to utilize the information or decide, I don't need to pay attention to this. So that's beta 1, and that's 12 to 18, somewhere in there. And then what I was talking about earlier, high beta, that's 20, 19 or 20 up to 30s, in the 30s. And that is, although necessary, right? We don't want to live up there. It's your survival. It keeps you safe. It's what helps when, you're hiking down the mountain and you hear a growl. You don't stop to think and check your way. You're gone, right? It's instant. It's fight or flight. But our system's made to be flexible, not to stay in one area like that. And so when we have that overwhelmingly predominant of high beta, we're anxious, we're hypervigilant, we are reactive, and we are not using cognitive tools to plan, to answer, respond, all those kinds of things. So those are the main ones we look at. There's a couple others.
So you kind of need this like flow state in between them all at certain points for certain things. And if you have dysregulation, it could suppress or heighten certain behaviors and other patterns.
Yeah, that's really well put. It's the balance, right? To be able to enter in and pull out of all the abilities of our brain as needed, instead of getting one thing taking over. So, and also we're looking at, so beta in the front left does something different than beta in the front right. And alpha really lives in the back. So we want it in the back of the brain, but it can show up front and cause trouble.
So if you see these in the wrong place, it's also a problem.
Yeah.
Interesting.
It's also an indicator.
And then how do you manage that? Like, how does neurofeedback look in terms of a visit, and what does it do? Because I'll tell you the way that my 6-year-old describes it, and I think it's so fascinating. So
yeah, I'd love to hear
your science words, and then I'll tell you the words of the 6-year-old.
Yeah. Well, so what they're doing as a session, they come in, a client comes in and they sit in a comfy chair and they're watching a show, a movie, a game, a screen, or listening to something. And there's a couple sensors on your head. And if your brain is going in the direction we want, that's a more functional, healthy pattern of what we're measuring, the screen is bright and smooth and the sound is clear and crisp. If the brain goes towards the direction that was giving trouble, like causing these symptoms to show up, it looks like a shadow comes over the screen from the outside in, or the sound can get quiet or stutter. And without really having to try, your brain wants to watch what it was engaged in. So if it's a show, or a movie, it's going to say, well, wait, I want to find that again. It's a pleasure seeking organ. So it's trying to get back to that. And it will try lots of stuff. And what's really neat is as you watch, because if we're running the session, we're watching their brain waves on a laptop and they're watching a different monitor. You can see as the session goes on, the brain figures it out. And pretty soon the screen will stay bright almost the whole time towards the end, right? Or the sound is nice and crisp. So the brain figures it out. And as you go through sessions, the more you do, the sooner it figures it out. And then people start to notice subtly in their regular life changes. So maybe they're not waking up with a stomach ache. Maybe they were with it the whole time in class. And picked up the whole lesson with no trouble, or we didn't scream at the driver next to us on the way home. But
Or throw our
subtly,
coffee cup at the windshield.
yeah, oh
Oh.
yeah, that's a bad one. But it's a subtle change, but then it builds. And then we watch for how consistent does it stay. And once it gets to be really consistent, we start to say, okay, well, maybe we are going to titrate off how often you're training and see if it holds. And if it holds, you're done.
So would you describe that as neuroplasticity? Like that's a big term, but it's like the brain kind of remodeling for the positive.
100%. Yeah.
Just,
it's an efficient organ. And so it holds because now you're getting good response, better sleep. So that fills your bucket and your resources are full, right? Or you're able to take in, so the frustration level is lower, or there's less tears, whatever change we're looking for, right? Or learning's easier. When it holds, your brain will hold on to that, what made that work. So it's positive reinforcement, right? Is the basis of it. There are a lot of types. That's the traditional type, and where we start most people. We also have neurostim, which is putting a little bit of current into the brain. Red light therapy, photobiomodulation, that's the same thing. So there are other choices and other directions you can go as well.
Yeah. And is that like red light therapy? It's going to reduce inflammation, stimulate mitochondria. And from my understanding, that's like brainstem kind of activation. Is that correct?
Yeah, some of it. So we have a couple different tools with that, but one of them has like a cerebellar site on the back of it. So it goes right in the deep part underneath the back of your skull to try to hit the cerebellum. So it also, the blood flow and the mitochondrial activation is the biggest piece, but some of it also pulses. So it's actually entraining the neurons firing. So it's not just blood flow. Yeah.
So those that are like slower to react, you're able to stimulate them to react on a better pattern. Like you said, too slow, too fast, not good.
Right.
Yeah.
Yeah. Well, and like your airway issue, right? If the breath is not regulated well, inhales, exhales, the carrying of oxygen up through into the brain, through past the blood-brain barrier, it's the same idea. We want the blood flow moving, and that breath is what is our pump, right? Like, yep. We get that. And so, yeah.
So that's where you'd see an overlap of individuals with like airway related, sleep related issues. And I think that's where we overlap a lot, is because so many of the patients I see are going to be your fit female. Like they come in, they know they're brain foggy, they know something's wrong. They're not sick enough for anybody to ask questions. They're on antidepressants, they're microdosing, they're doing all these different things to try to help them cognitively. And they kind of go down this airway rabbit hole. But what I see a lot of is we can fix the structure, but we can't always fix the brain just by itself. And so we can get people breathing better, but the way that they're operating is still in either this heightened state or something that hasn't been addressed. And I think that's where some of the overlap is, because in terms of adults, like what are some of the symptoms that you're seeing? And even when I'm reading about neurofeedback, you see it advertised for people that are trying to like improve their flow, motivational speakers, like high level executives, bringing that focus in. It sounds like there's a lot of overlap in just general health and well-being.
Yeah, and there are practitioners that are really focused on peak performance, and they do amazing work with those high level executives, athletes, musicians, anyone like that kind of thing. We have a gentleman that is reporting that all of a sudden his jujitsu is amazing. And that wasn't what he came for. I would say the adults that come in, brain fog, big one. And if you ask, how's your sleep? We get, oh, it's terrible. So
I wake up at 2 with the weight of the world on my shoulders.
Yeah, I can't fall asleep. And then everything wakes me up. And then I can't get back to sleep, or I can't drag my eyes open in the morning because I'm so, just not getting restorative sleep. So yeah, that's a big piece of it. And like you said, you can help with the physical part and the appliances or anything else that need to happen for that airway to be functional as you can get it. The neurofeedback is a nice pair with that, because that will help healing the neurons and get those firing patterns back where they belong. So now that the flow is so much better for them and the oxygenation has helped, our apnea is taken care of, those kinds of things, then we can take care of the stuck pattern that's causing the other issues and get it all back on track.
And it sounds strange, but one of the first things that you guys thought would improve, at least for my son, would be sleep quality. And even though his structures are far from ideal because I'm a perfectionist, that was really very dramatic, very quick. Just like and I don't know if it's like a reflexive, just fight or flight. He just seemed calmer and more rested in the morning. Mm-hmm. Like there was just less dysregulation. So I just thought that was fascinating.
Yeah. I'd love to still hear though, what was the 6-year-old?
Okay, so this is so I love it because I use kids' words all the time as proof of concept, because I have parents come in all the time. They're like, my kid doesn't mouth breathe. Yet I'm sitting there watching them sit right next to their parent and their lips are just half an inch open. And the parents are like, well, because they're not, all the way open, like they're at the dentist holding their mouth open for somebody, they're not mouth breathing. But then the kid sits in the chair and I say, what do you like better, breathing through your nose or breathing through your mouth? And there's no wrong answers. And they kind of sit for a minute. And some of them have already been through myofunctional or speech therapy. Like they know the right answer is supposed to be your nose. So you can tell these like super chapped lips, like their tonsils are huge. They point right at their nose and they're like, I love my nose. I'm like, you clearly don't. But most of them will give a true, honest answer of my mouth. So the same thing, I ask these questions of my kids when I put them through certain things, or they'll just offer it. Like we came home from a craniosacral conference once. They were like little models or whatever. My boy sitting in the back seat, he goes, that made me feel really good. It made my body feel happy. And I was like, oh, you're not one to offer much. So for neurofeedback, I say, okay, so what happens? He goes, well, I sit in the chair and they put my space cap on and then I watch Ninjago. And I go, well, what happens when you watch Ninjago? He goes, well, the screen gets dark when my brain's not working the way that I want it to. And I go, what else? And he goes, well, it gets really quiet when my brain's not working the way that I want it to. And he goes, I have to make the box bigger to make the screen bigger. And I go, well, how do you do that? He goes, well, I take my tongue and I push it right up against my front teeth. And I sit there and I think. And so for me, the tongue to the spot position is really impactful because to me, it signifies like a calming response and oxytocin release. Because I see so much object fiddling, nail biting, thumb sucking, pacifier use, and so much of it is related to low tongue posture and the brain not getting the feedback it desires because of this kind of like oxytocin loop. So for him, his verbiage is that if he can give himself that physical feedback, he can calm the brain to a more appropriate spot. And he liked coming out of those sessions. Like he was always a different and just more regulated version of himself. And I think that's what we saw over the time that we were working. And like his start to finish, beginning of the school year to end of the school year was significantly different. But I mean, from a hormonal response, I think the way that he would manage getting the box bigger and getting the volume to go up,
I know, really, I think it's clever.
Crazy. Yeah.
I think the kids figure it out sooner, actually, often than the
It doesn't surprise me. I mean, they figure out myofunctional therapy sooner. I'm like, hold your tongue up there. And they're like, oh, perfect. And then adults are like, I have a tongue. I didn't know I had one. I thought it was actually my lower jaw. Like, I didn't know it moved. So I feel like there's an eel in my mouth is what they say sometimes when they're trying to like learn how to do that stuff. But there's such an implication for improving mental health and stability now, I think, as we're shifting or hoping to shift away from more medications. But the hard part is, how do we get there? Like everybody's such a puzzle. So when people come in, how does that look? Like you guys do, I know you guys do a consultation and then you put them through kind of the treatment planning with the data gathering. How can you describe the flow for people listening so they can have a better understanding of like what they'd be walking into?
Yeah. So, the number one thing is to reach out, right? And we'll schedule a consultation. It can be in person, it can be on Zoom, but it's really the place where you get to explain what's going on and what are you so frustrated with and what have you tried and all these things. And then, we get to explain what do we do and how does it work? What are our fees? All the nuts and bolts of it. And then we schedule the EEG recording. That takes about an hour. And then it takes a week or two to get all the data analyzed and a report built and to come back together. And that it also can be Zoom or in person. So we can say, this is what we found. This is what we recommend. A small percentage, we say we need to refer you for a neurologist or a cardiologist, or, it depends, right?
Because you're seeing other cofactors.
Yeah, other things are showing that we need, that are beyond our scope of practice, and we might, we need to have someone overseeing, or they need additional support from, if it's a ischemic type thing, we want a cardiologist on it so that we know the blood flow is good enough.
Yeah. So you're able to catch stuff like that, seeing ischemic flow, like potential history of stroke or like you said, TBI.
Yeah.
Are you, I mean, in terms of like tumors and things like that, I imagine that would be something that could pop up.
They can show up, but they also sometimes can hide. So it's not a foolproof on that. You really need MRI or other imaging for that stuff. But there are indicators when there's very localized different activity going on that's very specific to one area, and we want to say what's going on there, right? Because as a whole, the brain works together. So when there's very localized things, we usually call someone in or offer referrals. But most of the time, the recommendation is, let's start neurofeedback training. We're gonna ask for release for any prescribers if you're on any medications, or other physicians or medical help that you're working with, so we all can be in the loop together. And then we'll start. And most cases 20 to 40 sessions. That's a guess. It depends on the EEG. It depends on what else is going on at home. It depends on how willing you are to drop your THC use or whatever else is going on in your world. So that's a general thing, but the kids respond faster than adults, but the adults still respond. So it's remarkable.
That's great. Yeah. And then one thing that I thought was really neat at the end of it's never ending, right? Like you could do it forever. But when we started seeing results, you guys are able to kind of take the data points that you've collected, because in each session you're gathering data too.
Yep.
So it was really neat to see the graph and the progression, and also note the changes that we were seeing behaviorally, which was really impactful. And so, like you said, 20 to 40 sessions, you're seeing with many patients, I'm sure, that are either cross-medicating, whether it be prescribed or not. And so for a lot of those, you're going to need them to either taper off or stop. And that would be the hope anyways, correct?
A lot. Yeah. For most people. And it's a pretty simple, when we start to see changes, we sometimes also will start to see side effects. And it's not because the changes are bad, it's because the brain's more efficient now, or it's made just enough shift that the dose they were on of whatever it was, an SSRI for depression or a sleep aid or whatever else, is too much now. And so that's why we ask for that release, so we can talk all of us together about reducing safely and weaning appropriately with medical oversight, not just dropping a drug, because we don't want to do that. And so the physician's also aware of what we're doing and why, and what we're asking for, and helping the client navigate those conversations.
And then I'm sure you're seeing, especially in Colorado, a lot of people that are medicating themselves, maybe not appropriately, with things like THC, because THC is going to decrease neuroplasticity, right? Like it's going to let the brain react less.
Yeah, and it's got a pretty clear signature in the EEG if someone's using regularly. So usually I will say, so how much are we using, right? And they'll be like, oh
yeah.
But yeah, only a while. Like, no, not true. But it actually is one of the few meds that really gets in the way of the success of neurofeedback.
How about alcohol as a depressant?
It's really not good. It's not as blocking. But the neat thing is, if we get the rhythms more stable and functional, the wish for alcohol decreases.
So the addiction can be taken down. Is that one of the things that you guys see in adults, is addictive patterns? Kind of like the same thing with social media. Interesting.
Yep.
And then things like, there's a lot of things on the market, like nootropics, like Thesis is one of the brand names. And then there's also the big talk about like microdosing psilocybin and what is it? And MDMA, right?
NDA.
Is the other one?
Mhm.
Yeah. Do
Yeah.
you see an impact, or is there not enough data because people aren't offering that information? And I know the studies are really isolated.
Right. No, I mean, we have kind of a directory almost of what, if you're using all sorts of medications, substances, solvents, all kinds of, street drugs too, what it will show in the EEG, or how it changes the EEG. And, if you know the half-lives and all that stuff, well, this is going to be impacting you for a while. I don't think I've come across anyone recently that's microdosing with psilocybin and then we did an EEG. I would love to, because I want to see what
Mm-hmm.
it looks like. But unless you have a before and after, a pre and a post, you wouldn't. It's not apples to apples. So yeah, but there are other things like benzodiazepines, or even the SSRIs or the stimulants for ADD. We know, we don't say don't take those,
Mm-hmm.
but I want to know so I can kind of interpret around what's in your system.
So you don't have an outlier, and
Mm-hmm.
you're kind of assessing, being able to assess more directly, like this is a problem,
Right.
could be interfering with our ability to make positive change. And
Right.
that's where kind
Right.
of navigating with a provider would be helpful too. Yeah,
Yeah.
it's all just so fascinating. I think there's just such an overlap. I have just a few more questions in terms of like nutritional. Are you seeing inflammation be a problem with cognition, neuroplasticity, implementation of neurofeedback, like people with poor diets versus those with healthier diets? Or is there any correlation there at all?
No, there is definitely. I mean, we're a whole system for sure. And we also work with Dr. Michael Pierce, who's a functional
Mm-hmm.
neurologist. And, he's taught, I'm a student of the most fledgling sort with him. But like the difference when someone is taking good supplements, good nutrients that are really helping the brain, eating healthy and avoiding sugars and processed food, and the difference between that and someone who continues their fast food diet or standard American diet while they're doing neurofeedback is markedly different.
Yeah. Yeah. I can only
So,
imagine. That's what I tell a lot of our airway patients, because they're like, well, he's really healthy, but we have to do this and this and this and this and this. And at the end, I applaud them and I say, I am so glad that you guys live such a healthy lifestyle, yet you still have these concerns. Could you imagine how much worse they could be if you didn't work as hard to maintain just general health and well-being? And I think that resonates a lot, because they're like, oh, we do a lot more than the neighbor next door in terms of maintaining our family's health. And I think it's hard as a parent to hear like, oh, there's so many other things out there that we could be doing, but it's so nice to have this conversation and know that there are things that are accessible beyond medication. How do people find providers like you? Like I'm so lucky that you're my neighbor, but how about for those of us that aren't in Colorado or Illinois? How can we find other providers to
right.
make connections to?
Well, the best, there's a couple certifying bodies. So BCIA, which is Board Certification and International Alliance, has a directory, and it's bcia.org.
Mm-hmm.
And that website you could put in, within 10 miles of this zip code and find board certified neurofeedback practitioners. That's probably the easiest way to go. Even Psychology Today, who is kind of the biggest directory for mental health therapists, you can search by neurofeedback.
Oh, great.
So, but you do, a couple of things to think about would be find someone who's board certified. It does matter in the sense of they have the foundation and the education to be fiddling with your brain waves, right? It's a pretty important organ. And
Yeah,
so
I
you don't
imagine
want
this, if not done appropriately, could be the wrong direction for someone.
yeah, I mean, done safely, it's very, very low side effect kind of a
Yeah.
situation, but there can be stuff. And there are, unfortunately, products out there that are not regulated and you don't really know what they're doing to you. And most of the time when we get somebody who's tried one of those, they're trying to help us get back to their
Mhm.
baseline before they started that. So yeah, but so board certification in that. There's also a board certification in EEG. It's called a QEGD or DL. So it's a diplomate into EEG. And so that's all the training and the mentorship and practice to be doing the EEG work and doing that assessment. So those are really good places to start as far as finding practitioners. Yeah, I mean, word of mouth, but
Yeah,
Facebook.
we can link all this in the show notes too.
Okay,
And
great.
then I guess just to close, is there anything that you wish more people knew about neurofeedback, or wish you knew that they knew differently? Is there anything else that you'd like to add kind of about the benefits so that we can
Yeah,
keep
I would
sharing this
say
message?
the thing that comes to mind for me most is if you're a parent and you've got your little one that's struggling, don't wait to get the EEG done. It doesn't mean you have to do the neurofeedback, but at least you then have a baseline of an image technique that will tell you exactly what's going on in their brain at that time, at that age. And so if they, grow out of it, or you get to 12 years old or 15 and new things are showing up, you can compare. And that's important information.
Because you said some of the symptoms in teens that you're seeing are pretty scary. And
yeah.
I mean, we say the same thing about x-rays. Like it's not that I want to irradiate people, but if I don't have that map, I'm truly guessing with what I'm doing, and we don't have anything to compare it to. So, I mean, I think that's a really good point to make. Like maybe you don't determine like we're doing okay right now. We have this map. We can reanalyze where we need to. But you won't know what the past is if you don't have that information.
Right. And I mean, the other thing is it doesn't change your personality. It's not something that zaps your brain. It is not electroconvulsive therapy. Are you going to shock my brain? We get a lot of those questions. But the final thing I would close with is if you are ever considering for yourself or a child putting someone on a psychotropic med, for depression, anxiety, ADD, any of the above, get an EEG done first. So you're not guessing, because that's what the psychiatrists are doing. They're not trained in this. And so they don't know, they're going by symptoms, but you can get right to the heart of it a lot quicker if you get that done and know which ones to avoid and what might be really good help and give you more direction.
That's a really good point. And I mean, I think we don't think of it like that, right? We go, and we hear it a lot too. Well, I was at my doctor and they said it's fine. But how do you know it's fine if you don't have the information? So I think that's really one of the huge values of it is just being the ability to see inside and know what's going on. So, well, thank you so much. I am so excited about collaborating and friendship. Yeah. And I'm really this is the stuff that fascinates me. It's pieces of the puzzle that we can help put together and peel back those layers, because I just really don't think we can do it alone, which is one of the purposes of this podcast. So, well, thank you all for listening. I'll link some of this information as well as Lisa's website on our show notes. And until next time, thanks, Lisa.
Yeah, thanks so much. It was fun.
Thank you for joining us on the No One Told Me, the Airway Health Connection, the Untethered Way.
We hope you're leaving with new insights and feeling empowered to take charge of your airway health.
If you enjoyed this episode, be sure to subscribe and share it with anyone and everyone who needs to hear it.
To learn more or get in touch, visit us online at untetheredairwayhealthcenter.com.
Remember that when you breathe better, you live better.